Hi, this is Linda
And this is Leslie.
with Let's Talk.
I'm so excited that we're going to talk today, Linda.
Whoa, we're with Ebony, Leslie.
Yes, this is such a dear friend of mine. Her name is Ebony, and she has a wonderful topic that she's going to be sharing with us about home health care and how home health care heals the heart.
Wow. What does that mean? Ebony, can you share with us?
I'm a CNA, which is a certified nurse assistant, and at the moment I do home care. So a lot of times you go into a home, you clock in, you do whatever they need, which is fine, but it's in return when you actually give a little bit of yourself in return. So it's like a back and forth thing. Your heart is in it. It's not a clock in and clock out thing.
What do you get out of it? Like you said, it heals your heart. How do you heal your heart? What does that mean?
It's interesting how like a caregiver, no matter if you're getting paid for it or if you are, just a family member, you go through your own issues, you go through your own problems. But when you step outside yourself to help someone else, you get something in return. It's a very humbling experience. You see things, you learn recipes, you learn about history, you learn about all these things about something. So it kind of takes you out of whatever mental, physical state that you're in. You're focused on that person, and in return, that person's giving you something and that they don't even realize they're giving you at that time.
Wow. How do you do that? It sounds like you have to kind of forget about yourself. How does that work?
Honestly, for me, it's like a one-on-one thing, which I love one-on-one. So when I go into a client's house, it's more of what do they need while I'm there. I try to figure that out. And then outside the surface, I try to see what else I can do besides that. Does God want me to say something? Does God want me to do anything? Can I do something just to leave a mark, something to keep them going? Because a lot of, with the COVID, it's a lot of mental things going on. A lot of people are declining. They're by themselves. There's no more hugging. There's no more touching. There's no more communication, really. So they're locked in this house. So to have somebody like laugh, giggle, cook with them, just simple things, is very uplifting.
Since you said the COVID, is there a big difference in your feel of home care before and after now? How does that affect you with your clients?
I don't think it's a struggle getting better. I believe it's makes them isolated. It makes them isolated because you can talk all day long, but a lot of people miss that touch. A lot of people miss the visitors. They miss the holidays. They miss that. So when you don't have that anymore, it could be a decline. Sometimes, meds do help. Don't get me wrong. Meds are good. But I feel like your mental health and the meds and exercise and everything with that helps them be better moving forward where they can take care of themselves. It's all like a balance.
One thing that I hear in what you're saying is that not only are you impacting them physically, but you're also impacting them emotionally. How in that turn has affected you?
You know what? It's a healing. It's healing for me because I'm not thinking at that time about me. It's not about me at that time. I don't have to think about the thoughts or whatever's going on with me at that time. I'm actually focused on that person. So it actually makes me feel good just by talking to someone, seeing that, okay, I make them smile. I make them happy. I make them, just it's the littlest things. It's not like I'm just going out of myself. I'm just being me. And that's all that's needed at that time. So that's what I try to be is me at all times, besides of, textbook is good. Don't get me wrong. But sometimes you have to look outside of that and see what that person needs also. And then you'll see as you go, they'll say little stuff. Oh, I need this, or I'm so glad this, or they'll let you know as they're talking to them what they need. And 9 times out of 10, they want that companionship.
Yes, that's so true. How long have you been doing this, Ebony?
11 years.
11 years. Wow. This says a lot about a person, right, Linda? Because when you're caring for other people, and especially when it's a person that normally we're not prone to go and support, because when you're talking about people who are sick and elderly, that's not something that everyone readily gets into that field. So that says a lot about you, Ebony, to do that. And I do have to say this on the side. Ebony helped to care for my mother before my mother passed. That's how I got to know Ebony. And my mother just loved her. She thought of her as her daughter. And she had that caring way. And like Ebony said, she was just herself. She had that caring way that was able to bring my mother out of whatever mood she had, whether it was a kind word that she would say, and she'd call my mom a diva because she knew how my mother was so conscientious about how she looked. So she would call her my diva. And so my mother would be, oh, Ebony was just here. And I'm like, Mama, what were you and Ebony talking about? So she enjoyed that relationship. It wasn't just there to help her physically, but it was a relationship too.
What questions should we ask for an interview? What questions should we do that? And what things we should look for? That's what I really want to say.
One thing I would say is just sitting with the person, talking to them, you'll get their character within those moments. I would say do that first. Get to know them first, because you'll see what you don't like and what you do like just by having a conversation. But also, a lot of it has to do with background too. Some people are, just going to school and just do it on the side, and they just do it just for a little money. And in that conversation, you can pick up, what you're looking for and what you're not looking for. And then you can go from there and do like an outline, because I feel like not only should the main caregiver be there, but the client as well. So they can sit down and say, I need this, I need that, because there are home health aides where they can just sit with you and maybe cook here and there. But for me, being a certified nurse assistant, I do more bedridden, I do more physical therapy, stroke victims, I do more of the background. So I think it's more research of what you're looking for. And from what I'm noticing with the clients, they may find somebody, they may be fitting for it, but it's the one-on-one that they want. They don't want someone just clocking in and clocking out, which is really difficult for people to find right now, especially with COVID, because you want that. You want to be able to leave your family member with someone and not have to be calling or, cameras or whatever that need be, because you're afraid to leave your mother alone with someone you really don't know. So I would say background and research and talking to your loved ones and seeing what do you really want for your loved one, what type of person are you looking for, and then go from there.
That's good. And I'm hearing this too, Ebony, that not only is it a healing of the heart for the person that you're caring for, but it's a healing for the heart for the families too. Because
Right.
when you trust someone, that's like trusting your child with someone. When you're trusting your parent, who at this point has become so dependent that now they're dependent on someone else, as the daughter in my case, it was healing my heart knowing that my mother was in Ebony's care. So I didn't have to worry. I knew she would be cared for. So there's a healing there. So it's
That's
a
true.
twofold thing.
That's true. That's true.
Yeah, I love it. So now, Linda, I know that this is something that we had private conversations about, like this type of field. What do you think, Ebony, what type of personality or characteristics would be best suited for this line of work?
You can't be selfish. You definitely can't be selfish. You have to be flexible. You have to be a listening. You have to be able to go outside yourself when it's need be, because it's not all about you. You have to make sure that not only the client is safe, but you have to not only take care of the client, you have to take care of the caregiver and the family. And what I mean is, keep them involved. Communication, what's going on, safety, all that, because as a whole, you're not just directly with the helping the client. You're helping the whole entire family. Like you were saying, Leslie, it spreads out to everyone, because it's not easy. It's not easy when you see a family member decline. It's not easy sometimes when, one person is doing everything and you don't have any help. And then when you get that help, you get that break, you get that peace of mind, you get that guidance, or you get information that you may have not known. Oh, I didn't know I can use, this safety belt. Escape belt. I didn't know that I could use this shower chair. I didn't know that, it was not a safety thing. I didn't know. So it's like a communication thing, because you're trying to help this person stay at home. And then you want the family to be secure at the same time, because you want to avoid putting in the, home, nursing home or hospital. Not saying there's nothing wrong with the nursing home, but I feel like at home is the best healing process, because you're at home, your things are there, your family is there. You have accessible things to, to use all your stuff.
Yeah.
So when I go to a client's house, I say, I'm your visitor, I'm your assistant, I'm here to visit and assist you. Because some people, when they say, what do you mean I have a caregiver? I don't want them here. And you have to let them know that's not the only reason why I'm here. I'm here as a friend. I'm here as an associate, your assistant, not to boss you around, not anything like that. So
Exactly. That is so true, Ebony. And I remember just even at times, and I don't want to make this about me, but I can just totally identify what Ebony say. When I would call my mother, she said, "Oh, Ebony's here," and I said, "Oh, okay, we'll talk later," because I knew she was okay. And that is true when you're talking about dealing dealing with people who are dealing with your loved ones. You definitely want to have someone that you trust, and that
right.
doesn't happen overnight. That it's a relationship that's formed. So Ebony, I applaud you. I applaud your desire to do this line of work because it takes a special person to do it. And I think you are that person.
Yeah. Ebony, what about a loss when you lose a patient? How are you with that?
Honestly, the first time I have experienced it in a home care setting was with Eleanor, which was Leslie's mom. That was more of, it was not just me being her caregiver. She was my friend, and she was my friend for like 6 years. And even when I moved, we would talk every week. So it's something that, manifested as something different. It wasn't easy, but you know what? It was, God gave me peace in it because I had that friend. I didn't know when you pray for certain things that you need, you sometimes forget what you pray for. And then when it happens, God remind you, I had this person because you needed it. Because that right there with Eleanor, that right there was the healing that I really, really needed at that time. And I didn't realize it to the point where she had gone. And that's when I realized, I was like, oh my God, okay, God, this is why, our relationship and how we were introduced, how everything happened for a reason. It was all God made. And that's what opened the door that I wanted to do home care. That was where my heart is. And I said, I want to do home care. That's what I want to do from now on.
Mm.
After so many, how does it affect you?
It it could be heartbreaking at times. I call it like the switch on, switch off. I have to, keep my emotions in check. I do my devotionals, I do my reading, I do my singing, I do whatever I can just to, but it's the piece of it, knowing that I had that time with that person and knowing that, that time that they affected me and I affected them. So I can move on from that and then be able to give whatever I receive from that person or learn, I can give to the next person.
Wow, that's beautiful. I love it, Linda, because it's about healing the heart in so many ways. And that speaks volumes, Ebony. That speaks to a lot of different areas when we're saying healing the heart. Home health care. I never would have thought about it in that light. What about you, Linda?
I thought that's amazing. I mean, I know with my mom, that's what we're trying to figure out and different things like that now. So having you on helps a lot of just even asking the questions. What is the biggest mistakes, like for me and my sisters looking for that from my mom? What are some things that we should know or mistakes that a lot of people make?
One, to know that your loved one is still them. It's just, it could be a disease or it could just be a changing of life, and that they just need just assistance for right now. A lot of family members it's difficult seeing that their loved one is, it may be declining or they're shifting and things like that. And a lot of times, instead of it bringing people together, it can get frustrating and bring things separate. And a lot of times, as a caregiver, when you see something like that, you kind of have to have balance and bring to the whole thing that everybody's helping, everybody plays a part, and that this is just something that's temporary. Your loved one is still there. It's just a decline at the moment, because you're going to have good days, you're going to have bad days, depending on what the diagnosis or what the setback is.
And then the second question will be, what or how can we make it go smoothly when the elderly don't know it's a problem? Like, they don't want home health care. They think they can still do it on their own. What are some things that we can do to make that transition go?
I actually had that problem. I went to a house, and this client was like, no, I don't need it. And the daughter was stressed out because she had to go to work. And I'm like, well, let me talk to the client, let me see. And it's, when people think about someone coming into their house, they're thinking about someone taking charge. They're thinking somebody's going to just tell them what to do, what not to do, or you can't do that. That is not the idea. And I think that's the confusion there. We're supposed to be there as a caregiver. We're giving care. So we're not disrupting their routine. We're there to help them. We're there to guide them, but yes, in a safety way. But it's the way you word things. If you see something, you say, oh, do you think that's a good idea? Or maybe we should try this. Why not? But you do have strong-minded people that will straight up and say, I'm not doing this. I don't want to do that. And you just say, okay, because it's their home, they're independent, and you just roll with it. And you just keep communication with them, their family, letting know what's going on. But as long as they're safe and they're happy, let them do whatever they want to do, as long as in their safety limits.
Good. That's good. And that's being respectful of the family too. And that's being respectful of the person, the client, that they remain there, keep their dignity. Because I know that's huge for people when they get older. Okay, they realize that they have needs, but they still want to have their dignity. And I don't want that to be misconstrued when we're talking about home care. Yes, you're coming in their home, you're supporting, but you're also helping them to still be independent to some level of, respect. There's still some level of respect there in that regard.
Right.
So that's good. That's so good, Ebony. I just love what you do. I love it because there is such a need out there. And we don't want to see our elderly parents decline. We don't want to see their health go down, but we also want them to be cared for still,
Exactly.
So, Ebony, are there any words that you would say to someone who is, like Linda was saying, looking in that direction or considering even going into that field?
I would say that you really have to see and check out who you are as a person. Is it something that you were willing to do? Care for someone else, because you can't be selfish. You have to be, a giver. You have to be a carer and things like that. And then you have to realize that the people you are caring for, they are individuals and they are still the same people. They are nurses, they're bus drivers, they're doctors, all these people, they're people. So what you're seeing could be a decline, but they're still a person and they just want to be treated as that person. And then once you treat them as that, you will see them come around. You'll see them smiling. You'll see them laughing. I think that's like the best medicine you can give someone.
So, Ebony, I want to ask you one last question. What would be 2 or 3 suggestions you would give to help people with their new caretaker?
I would say if you have like a 24-hour thing and that client or patient is at home, I would suggest one of those lock boxes that has like the combination, the key comes out. And then if you have somebody that, you don't too much care for, or there's not a fit with your loved one, you can always change the combination. And then you don't have to worry about thinking someone's gonna, come in your loved one's house or anything like that. It's all about safety. The other thing is that when you go into someone's house and they're married, spouse, wife, that you're not only taking care of, that one, even though they want you to go and take care of that one, you still want to say, hey, are you okay, to the spouse? Are you okay? Need help with anything? Because, they're married, they're one, and, they're unified. Also, always include the family member in whatever care that you're giving. Always include them. It could be temperature. It could be something simple about a safety thing. It could be anything. Always communicate with the caregiver, because you never know if they're missing something. You never know if it's something they forgot, or suggest something. It's no harm of, giving any ideas that you think, but just the way you come and the way you say it also.
That's good. Those are very good practical tips. And I love that, Ebony, because you're right, Linda. These are things you don't think about going in, because I know when I was doing this for my mom, there are certain things I didn't know what to ask. I just knew that, I trust her. Well, how did I trust her? She came as a referral from someone that we knew, a mutual friend. I trusted the mutual friend, and I said, okay, well, let me go that route. But that's not always the case with everybody. So we were
Right.
fortunate to have it that way, but that's not always everyone's situation. So that's
Leslie,
good.
I just thought about that. Can you share some of your experience of having a caretaker or having, yeah, a caretaker for your mom?
Well, like I said earlier, one thing that was big for me was that I had to trust the person. You know, we had prior to meeting Ebony, I had a couple of people that weren't a good fit. My mother was a little stronger. She was still a little more independent, and she could kind of, and my mother was something else. She could still kind of dictate what she wanted to do. And so she would do things that I personally didn't like, but my mother was grown. But anyway, she would do certain things I didn't like, and the person would go along with it, and it wasn't really necessarily in her best interest. So, okay, that wasn't a good fit. We had to let that person go. But then when we met Ebony, and again, it was through a mutual friend, and that was just ordained because I don't even know how the conversation came up with the young lady. And I had mentioned, I said, yeah, I'm looking for some support for my mom. And she said, oh, I know a nice young lady. I know a girl. I know, not a girl. I know a lady. And she goes to the church. I said, who? And she said, Ebony. And I said, Ebony? I don't, and I was new to the church because Ebony and I went to the same church. I was new to the church. I didn't know a lot of people. I said, okay. And so I don't know how that happened, Ebony, if we talked on the phone or if you came over to the house, right? Didn't we set up a time for you
Right.
to come over?
Right.
Came over to
Hmm.
the house and she talked with mom, and it seemed like mom and Ebony hit it off right away. And I knew after that, after getting to know Ebony, talking to her, hearing her story from other people, that she was a quality person, a reputable young lady, a person of integrity. These were things that I was looking forward to. And she was a believer. I knew she wouldn't do anything questionable like steal or anything like that. So I was very, my heart was at peace. And then once I got to know Ebony even more, I was really at rest when she would come over because my mother would have a gap. There would be a time that the first young lady would leave, and then there would be a gap, and then Ebony would come. Well, I'm on the phone all the time with my mother, making sure she's okay. And then closer to the time Ebony was supposed to have been there, I would say, she said, oh, Ebony's here. I'm like, okay. Then I was fine for the next 3 hours because I knew Ebony was with my mom until she helped her get into bed. So it was very comforting knowing that we had somebody to care for her when I was not there. Someone that I knew would give the same kind of care that I would give. And actually, she gave even better care. Having the medical background, having the physical therapy background, she introduced me and my mom to a lot of things, like you had mentioned earlier, Ebony, that we didn't even know about. You know, safety tips that were very important. And my mom would say, no, no, Leslie, you're not doing it right because this is how Ebony did it. She wanted to make sure it was done the way Ebony did. And I was like, well, Mama, I don't know how Ebony did it. So, you know, it Ebony was the law, the rule of the land, the law of the land. If Ebony said it this way, it had to be the way Ebony said, and it's the truth. And I knew that my mom trusted her. So I loved it. I loved having someone that I knew that cared for my mother.
What about the very first time? Can you share that experience? Your first time having a caregiver, your first day. It has to be anxiety.
It was a lot of anxiety because I didn't know whether or not to trust the person. But the thing is, my mom was still mentally, that's, she never lost that part of her. You know, she could speak up, she could cuss. I'm not advocating that, but you know, she could she could say what was on her mind. So I knew that that part of her, she would be able to speak up for herself and take care of herself in that regards. And if there was anything questionable, she'd let me know. But it still was anxious because she was the person would come into the home. So, you know, later on I did put cameras up only because they were more for my peace of mind to to watch my mother when she didn't have anyone there. It was never necessarily to watch the young ladies that were there because I, at that point, the people that were coming in were people that I trusted. But it was anxiety all the time because you just don't know. You know, when you're not there, you don't know. So
Okay, Ebony, I know I keep saying one more question, one more question, one more question. Forget, I'm not even gonna say one more question. I got a question. It's so funny because when we talk, it just, you can go deeper with it. So from your experience, what is your fear going to somebody's house for the first time?
I honestly, I have anxiety because a lot of times I may know their name, I may, the address, everything like that, but I go in fear of, oh my God, what if I can't do this? You have all these doubts and things like that. So I have to be, there's a prayer that I say every time I meet a new client. And then once I ring that doorbell, I get in there, you just feel like this release and you feel more comfortable. And then you talk to the client, you talk to the caregiver. And then once you have those first moments of conversation, then I feel more comfortable. And then I'm able to, do whatever that needs to be done while I'm there. But for me, it's anxiety because you don't know. See, when you work in a nursing home, a hospital, or a clinic that I used to work for, you knew more background. And a home care, sometimes you don't know that much background. And even though they walk with a walker, they do this, a lot of times you walk in, it could be something totally different. So I have to be on it. Things can shift, things could change, and you have to know exactly what's going to happen. So I'm very thankful for my background because my background either will step in or God steps in. It's either one or the other.
Okay. I have another question. Another question for you. What happened if, say, two people, say, son and daughter, is telling you two different things for their mom? How do you handle that?
I listen to both, number one. And I always, after I hear that, I always talk to the client, the one I'm giving care to. And I ask her what she wants, what she needs. And then I go from there. And then I talk to my nurse and I talk to my manager to make sure that, the main focus is the caregiver of the client. It's all about safety, but I don't want it to where it's anyone's bumping heads because you don't want that in the house because, that makes the client feel uncomfortable, uneasy. You want everything to be peaceful and everything to go as a flow in the house. You don't want that. But a lot of it, when it comes down to family members knocking heads like that, it's because they don't know. It's a knowledge thing. If you don't know something, you don't understand something, you're going to come from wherever you're going to come from. So no one's wrong. It's just that where you're coming from is just different, your viewpoints and everything like that. So once you have like a conversation or you bring the nurse in or manager in or whatever it may be, communication, then 9 times out of 10, everybody's more relaxed. Everybody is understanding, and then we're able to focus back on the client.
That's good, Ebony. These are such good tips. I love it. And I'm sure you have another question.
No, I think I'm good now.
Well, I tell you, I just love this program today. It touched my heart, and it's so true that home health care does heal the heart. It not only heals the heart of the person that's providing the care, but it heals the hearts of everybody involved. So, Ebony, we really appreciate you sharing your insight with us. Is there one thing that you want to leave with the audience, something that you feel that would be beneficial for either the family that's looking in that direction or the person who's providing the care?
There's always help. Don't think that you're not going to get help and you're alone. Either God has you, or there's some type of social worker or information or facility that will help you in any type of way. It's very important to not only put God first and get knowledge, but research. Look at the reviews, look at the stars, look at all that, ask around, find out, especially if you're thinking about using a home agency or a nursing home. These things are very important because, like you say, you don't want to have anxiety when you're giving your loved one to someone. So you want to make sure you have the wisdom and the knowledge, because a lot of people think that they can't do home care and then they just put them in a nursing home, but there's always options. There's always options.
That's good, Ebony. Very good advice. Well, listen, this is what it's all about. It's about life's lessons. And here we have the biggest life lesson here, which is how our hearts are getting healed when we care for our loved ones. And it's about laughter, because we have to laugh. Laughing is good. The Bible says it's good like a medicine. And most importantly, it's that love, because what comes from the heart touches the heart. And that's what I'm hearing from Ebony. And ultimately, the goal is to make relationships that last. So if you like what you heard, please, please, please be sure to hit the like button, subscribe to our channel. We want to get this message out to as many people as we can. I know there are people on the other side that will too benefit from the wisdom that our dear, beautiful Ebony shared with us. So until next time,
Bye.
bye.